things that make us who we are. Some people are funny. That's a trait. It's personality. That's what this is. Personality traits personality traits are persistent behavioral patterns that do not significantly interfere with one's life, even though the behavior may be annoying or frustrating to others. So, even though someone's personality is a certain way, if my personality is, let's say, if I'm funny, it doesn't matter to you because it doesn't affect you. If it's me, it affects me, right? So the disorders we're going to go over. So that's personality, but the personality disorders, they affect the person plus those surrounding them. Okay, we're going to talk about narcissists. We're going to talk about obsessive compulsive. We're going to talk about a bunch of interesting things today. Okay, but that's what personality means. So personality disorder, traits, habits that comprise the personality are inflexible. Like there is literally no change to your personality. You cannot change a personality trait. That does not happen. Okay, it's rigid and damaging. Okay, impairment will affect the individual and those who interact with the individual. I think this is something we've all experienced, and we'll talk about it too. Right? If we've come across someone who's just bitchy, you can't change someone who's bitchy. It just doesn't work that way. It's their trait. We've all come across those people. It affects them as a person because now, if you're a bitch, you can't have relationships, whether at work or personal or intimate or friend, right? It affects the person and affects everyone around them. That's why the debate comes along. Can you really change someone? Is personality something you can alter? What do you guys think? Yes? No? Right? That's just, it's a very, very interesting topic. No, I agree with that. That's just my take. I don't think personality, you can't change personality. Yeah. More info and definition of personality. So again, it's pervasive, inflexible, right? Affects the way you think, affect, interpersonal functioning, impulse control, occupational, social, and relationship. Affects everything. Okay, I'm not going to focus on this. Now, onset, right? Common characteristics of personality disorders. Like what is the framework behind them? So, a human being, their personality is evident when they're teens or early adulthood, even earlier than that. Okay, there have been studies done um, in school, elementary school kids, on elementary school kids, their personality has been cemented in them at a young age. Um, you are who you are at that early age. Yes, there can be history behind it, right? Whatever traumatic past, but it's evident. By the time you're a teen, it's visible. Who you are is visible. Persists throughout the person's life. I mean, it dies with you when you go, right? It stays with you. Lack of insight. So, um, I've worked with a few nurses who are just plain, I'm sorry, but just bitches. And when they are confronted with this, they're not aware. You know, I'm not a bitch. I'm just tough. There's a difference between being tough and being bitchy. So oftentimes, people with their certain personality traits, not oftentimes, but most times, they have no idea that that's how they are. Okay, they think that just this is who I am and it's the right way. Okay, failure to accept the consequences of behavior. How true is this? Okay, we're going to talk about certain traits, personality disorders that they lack the understanding that your behavior has a consequence. Okay, they lack that understanding. Pattern of perceiving, thinking, and relating that impairs social or occupational functioning. Okay. I don't really cover this that much, but the epidemiology behind it. A lot, not a lot, but some uh, personality disorders have these comorbidities behind them: depression, panic disorder, substance abuse. Substance abuse just tags along all the time. Eating disorders, anxiety, impulse control. We'll talk about it today. Interesting stuff, guys. Diathesis stress model, right? Nature versus nurture. I think genetics is a huge deal with this. With personality traits, genetics is just, it's there, you know? Again, I don't focus on this. Diathesis stress model, there it is. That's all you need to know. Okay, so how do we assess someone with a personality disorder? Oftentimes, it's not a very structured environment. Okay, semi, because we want their true colors to kind of seep through, if that makes sense, right? We want to see their true colors come out. So we try to give them, when we assess them, if they have a certain personality disorder, we try to give them some freedom to see where, where they lean towards whatever personality disorder. I don't cover this. It's not part of MMPI, Minnesota Multiphasic. It's basically like, there's CWA, cows, certain other diagnostic criteria. This is what this is. And we technically, what we do is we gather full medical history, full psychiatric history, and whether or not they're at risk for SI. Okay? Not really pertinent. Trust me on that. Okay? This is where we're going to start. So when you're studying, so what we are studying, what we're going over today will pop up on your proctored and on your final. Okay? And by the way, the final, it's a bunch of repetitive questions and some new ones. Okay? So that's good, no? Repetitive questions? You all lie, right? Yeah. Okay. So we're going to talk about cluster A, B, and C personality traits. I'm pretty sure you guys have heard, type A personality, type B personality, type C. I'm sure you guys have heard that. So, cluster A. These guys are grouped in paranoid, schizoid, schizotypal. Okay? It's not schizophrenia, but it's traits. Okay? Sometimes when you go to the site and you open up the chart, it won't say schizophrenia even though you suspect they have schizo. It just says paranoid or schizoid. That's what it means, the personality. Okay, these guys are kind of odd. This group of people. We're gonna go over each of the three ones individually. They're kind of suspicious, magical thinking. Let me read your palm. It's all about the zodiac sign. Not like how people regularly inquire about horoscopes, but these guys think that is the way of life. If my zodiac doesn't tell me something, I'm not going to do it. And oftentimes these guys dress up very odd. And every time I drive through Atwater Village, there's like this truck and it says like tarot card reading. And there's always someone there who's dressed like, she's got like a weird headscarf and it's like purple clothing and she's got like a ball. Like that. Do you guys know what I mean? Exactly what the movies portray of what someone who's into this stuff, odd and eccentric, okay? Do you guys know what I'm talking about? Right? Alive, right. Okay. That's what it is. Let's go over paranoid. Literally paranoid personality disorder. Distrust, suspiciousness of others, such as their motives, and interpreted as malevolent. This begins in early adulthood and is present in a variety of different ways. Rigid, hypervigilant, reality is distorted, everyone is out to get them. These guys, you kind of have to be aware of them if you're caring for them, okay? Because they will get you. They will get you. They will get even, okay? Everyone's out to get them, okay? I know this one person. I'm pretty sure she's got paranoid personality traits. She thinks that every time she's at a red light and there's another car right next to her, that they're always looking at her and seeing what's inside her car. Okay, that's her. She's paranoid. She always thinks it's every car, not just one car, but every car, even those people in the other cars who don't look at them. Okay? So, this is the kind of things that they say, paranoid personality disorder. People will eventually try to hurt me. So I can't trust anyone, right? They will always take advantage of me. Okay? People will try to bother me. So they kind of lack the social skill. Don't get mad, get even. They will hurt you. They really will. Any insult, no matter how slight, directed at me should be punished. How insane is this? Always be prepared for the worst. If I get close to people, they can find out my weaknesses. Okay. Schizoid. So with schizoid, detached from social relationships. Okay, complete detachment and restricted range of expression. Detached from social relationships, lack of expression. They will not show humor, happiness, sadness, aloof, isolative, humorless. Okay, they kind of have psychotic episodes. Well, they'll experience anxiety, depression, dysphoric, sometimes hallucinating. Okay, they don't really care about relationships, whether intimate or just friendly. They don't care. So if you're caring for someone like that and they're kind of in their room, guarded, it's okay. It's fine. That's how they are, right? Respect that need for isolation. It's completely fine. We usually don't want to enable this, right? But with these guys, with the schizoids, yes, that's okay. Okay. And this is how they typically are. There are a few reasons to be close to people. I am my own best friend, me, myself, and I. Displays of emotion are unnecessary and embarrassing. So if I'm happy, I'm not going to show it because that's just embarrassing. If I'm in love, I'm not going to show it because that is just embarrassing. What others say is of little interest or important to me because I don't care about anybody else. That's schizoid. Okay. You guys good? Makes sense, right? Kind of interesting. No? I always like this chapter. Schizotypal. This is very similar to schizophrenia out of all of them. Out of all of the A's. Pervasive pattern of social interpersonal deficits marked by acute discomfort with and reduced capacity for close relationships. So, cognitive perceptual distortions, hallucinations, eccentric behavior, beginning in early adulthood and present variety of conduct. So these guys are the magical thinkers. You know, the Armenian coffee reading the cup? Sometimes people go way overboard with them. Maybe other cultures have this too, I don't know, but this is kind of, sometimes they go crazy over it, right? Let me read your palm. The two lines mean you'll have like 5 husbands. One of my patients told me that one time. I was like, oh, interesting. It's all about don't cross the street. The cat walked by. Now, I'm not talking about like, it's not called stereotype. What is that? What is that word for it? Superstition. Superstition. Like extreme, like really believing it, right? Like don't put the knife on the table. Or don't hand me the knife, put it on the table, or something bad's gonna happen. Extreme, extreme, extreme. Bizarre speech behavior, strange appearance, visual disturbances. They do have hallucinations. Okay? Broken mirrors, spilled salt, don't put your bag on the floor, right? There's things like that. It's kind of interesting when you talk to them. You're like, wow. Right. Opening umbrella inside? Which one is that one? What happens if you open your umbrella inside? Because I did that yesterday. Bad luck? Okay. Oh. Oh well. Don't sweep your feet or else you won't get married. Man, that's why I'm not married. maybe that's the problem. Okay. Look at this. Don't sweep at night. Oh, that's the one. If mirrors break, it's pretty bad. I don't want to know. I don't believe in superstition, but I don't even want to hear it. Oh my god. Yeah. Schizotypal. There's a bunch of us, huh? Who have the minor version of the schizotypal personality disorder. So the behaviors, ideas of reference, odd, sixth sense, kind of telepathy, right? Clairvoyant, circumstantial. Everything's a metaphor. The way they talk is metaphor. They're kind of paranoid too, suspicious, odd, eccentric, lack of close friends and confidence. Again, for these guys, just like the schizoid, if they want to be isolated, that's totally fine. Okay, that's fine if they want to just kind of take it slow. Okay, so how do you care for these guys? Avoid being too nice or too friendly. Set your limits. Like they will take control of you. Okay, give clear and straightforward explanations of everything you're doing, especially since they're kind of suspicious to begin with. Just tell them everything. Okay, hey, this is what I'm doing. This is what's gonna happen. This is this. This is that. Because if you don't, they'll be like, what are you doing? Are you out to get me? If you're gonna, so be consistent with your schedule. If you're gonna change something, tell them way beforehand. Okay, tell them way beforehand. Okay, be very neutral, clear, simple. Okay, that's A. That's A. Now we go on to the B. These are the popular ones. I'm pretty sure we've all come across someone who's like this. If not all of them, some of them. Okay? The cluster B, they're the dramatic ones. They're the impulsive, they're the emotional ones. Okay? I'm pretty sure we've come across all of them. So, personality traits, you're not just going to see them in the hospital. You know? It's everyday life. It's everyday life. Come across a lot of these guys. Right? So, antisocial personality disorder. Okay. Maybe we've come across some people like that. Antisocial personality disorder. So, although this sounds like it's going to be about someone who doesn't participate and just doesn't socialize, that's not what this one is. Okay? So, pervasive pattern of disregard for and violating the rights of others at a young age, right? In theory, age 15. So, they don't care for others, they're aggressive, they'll manipulate the crap out of you. They don't follow rules because they just don't give. Now, my best example of what antisocial personality looks like. Any one of you guys, are you guys Game of Thrones fans? Anyone? Game of Thrones? No? One person? Anyone else? More people? No. There's a character. Her name is Cersei Lannister. Cersei Lannister doesn't care about anybody else besides herself. She's aggressive. She's manipulative. Doesn't follow the rules. Right? Do you know what I'm those who are fans, you guys know what I'm talking about, who I'm talking about, right? And yes, and inside. Absolutely. Right? Um she's got a whole bunch of issues. The entire family does. But that's antisocial personality disorder, okay? They will not control freaks, deceitful, lies, impulsive, reckless, irresponsible, lack of remorse. They will not conform to social norms. These guys will get their way no matter what. If it means I hurt you to get my way, so be it. If it means I kill you to get my way, so be it. This is it. So don't think of antisocial as someone who doesn't participate. Think of it as just the worst human being ever. Okay? That's antisocial personality. Right? Anti-society. Think of it that way. Okay? I don't know if I've seen, have I seen any other movie that can portray this? I'm not sure, but Cersei Lannister is the best one. And if you haven't seen Game of Thrones, oh my gosh, watch it. Watch it. So this is what they like to say: rules are meant to be broken. Well, what the heck is a rule? Idiots follow them. They have to be broken. My pleasure comes first. It's all about me. I will not allow myself to be frustrated. These guys, they can't be frustrated. No way. They have to be content and happy. I will do whatever I must to get what I want. I'm smarter than most everybody else. Borderline. So, borderline personality disorder. So, these are unstable guys, okay? They're like right there on the border between all good and all bad. I know I've come across people like this, okay? They're unstable in their personal relationships, in their self-image. They're impulsive, and this is apparent at an early adulthood, okay? They manipulate themselves and others, okay? They're afraid of being neglected, okay? They're unstable, okay? So these guys are the ones who can't be left alone. This is what I mean. So, you're gonna break up with me, right? Please don't break up with me. Because I'll die. I'll die if you leave me. They can't do it. And to seek and to gain all that attention, they're gonna cut their wrists and they're gonna hurt themselves in order to get that attention. Okay? High risk of self-injury and suicide. These are these guys. Okay? Okay? So they're very unstable in their relationships. Okay? It's just I don't fit in. I'm not perfect, so you're just gonna leave me and abandon me and I'll die, okay? I'll just crash or I'll kill myself. And they will really do it. They will go through with it because they feel like they don't fit in. And they're impulsive and reckless in their behavior because they kind of feel down and maybe even depressed and empty. Okay? And all of this leads to intense anger. Okay? Intense anger. And everything's either good and bad. Okay? I've had a coworker like this. One day she loved me. The next day I was the world's greatest bitch. And I'm not. Okay? But everyone thought this about her. Okay? So that's what this is. It's like yin yang, like polar opposite. They're right there on the border of exploding. It's either all good or bad. Does that make sense? The picture I've painted of what this is? Right? Right? So with these guys, I'm not sure who I am. I will eventually be abandoned. There's no place where I fit in, so please don't leave me. The pain is so intense I can't bear it, so I'm gonna cut myself. This anger I'm feeling, it controls me. I'm so overwhelmed. I'm just gonna run away and I'm just gonna die. And I'm actually gonna go through with the plan. That's what these guys are thinking. So, oops. I'll talk about cluster B, how to care for them later on. I chatted with someone really. Huh. So you guys still get good people to talk to on Seven Ghosts. It's insane, right? It's insane. It's really hard to have a conversation with them. Really hard. Really hard. Really hard. Because you don't no matter what you say, uh it's all bad or it's all there's no they're right on the border, you know? Yeah. Narcissists. I can say that I know a bunch of them. You know, a bunch of them. Okay? Right? Right? Do you guys? I'm pretty sure you guys know a bunch of them. I know. I've come across a whole lot. Right? Lots of narcissistic friends in the past. Right? Past relationships. This is a good one. A pervasive pattern of grandiosity, thinking that they're above everyone else. Fantasy. Sounds like a family member. Someone said that. Need for admiration, lack of empathy for others. And this is obvious in early adulthood, even teenage years, especially in today's society, right? These like young teens are growing up way too fast. Like I came across a 15-year-old the other day, and I'm like, "You're 15?" I was the dorkiest looking human being when I was 15, and she was just lack of empathy, complete lack of empathy. They do skip the awkward phase and they just become like these like egocentric people, right? These guys need consistent applause. Okay, ego. It's all about them. Ego. Okay? Ego. Big fat ego. Okay? Grandiose sense of self-importance. I'm better. So in a relationship, they will be the ones who are better and they will not accept their error. It's all about they're right and you're wrong, no matter what. Okay? And they'll make you feel bad about it. Because they're preoccupied with how powerful they are and how they have got the control and they're the one who's successful and brilliant, right? They're beautiful. They're the ideal love. Believes that he or she is special and important. That's why if you're pointing out my mistakes because I'm a narcissist, I don't have them. I'm important and I'm special, okay? And you have to admire them all the time. Oh, you're so perfect. You're so right all the time. You're just gorgeous. Sense of entitlement. I'm entitled. So how dare you have the better car? How dare you have the better job? How dare you have the better clothes? Okay? And they exploit personal relationships, right? Gaslighting, right? Making you feel guilty for something that you're not responsible for, lack of empathy. Envy is huge with these guys. Envy is huge. Arrogant, haughty attitudes. Horrible that there are so many people like this out there. Mm-hmm. Right? Things they usually say. You're thinking of who you know who's not like that. Isn't that interesting? I was gonna say that too. I'm like, I can't like who do I it's like very limited who's not like that now, right? Very few good people left, right? I must have my way in every interaction. I am more special. I should only have to relate to people like me. I'm admired. No one should have more of anything than I have. I don't have to be bound by the rules. Okay? It is very important to get recognition, praise, and admiration. No one's needs should interfere with mine. Only people as smart as I can understand me. I am right all the time. It's just a bunch of disgusting bullet points on this slide of the worst personality trait that you can possibly have as a human being. But it's real, right? These are the guys who revel in their pretty privilege. Do you guys know what I mean? Like if people constantly tell them, "Oh, you're so pretty and you're so perfect," and especially if they're narcissistic, they'll get it to their head that they have that privilege and it's all about them. This is what this is. Histrionic. So this is they're very emotional, attention seeking, and they will use their seductiveness and their flirtatious behavior to get that attention. That's the difference between histrionic and narcissists. Histrionic, they will go that extra mile to use their sexuality and their flirtatious behavior to get everything that they want. Okay, and I know some people like this. It's disgusting. Right? They're very emotional. Uncomfortable in situations in which he or she is not the center of attention. What do you mean it's not all about me? Interactions are characterized by inappropriate, sexually seductive, or provocative behavior. These are the people who will, if you're a female, these are the people who will wear clothes that just have everything hanging. It's tighter clothing, and they will suck up to the professor and flirt to get the best possible grade, right? They will use all of that, right? Rapid shifting and shallow expressions of emotions. They're up and down with their emotions. Use of physical appearance to draw attention, especially if they know it. Even guys, obviously, right? Utilizing their good looks to ace their tests, to get that job, okay? Very dramatic. And they do that. We've had some histrionic patients on the unit. Guys, I remember, who wanted to get more meds, and they would start to flirt with me and just compliment me. This happens in real life all the time. That's not very dramatic. And the thing is, despite everything that they all these like bullets that they have, they're easily influenced by others. They're kind of like pushovers in a way. Okay, that's why they're so emotional and dramatic. Okay, because appearance is important. If you're not pretty, I don't want to talk to you. People are judged on external appearance. If I think you're not pretty, then who the heck are you? That's what histrionic people think. I have to be noticed, so I'm going to go that extra mile to be a little more provocative. They use sexuality. I must get everything I think I want. Beauty is the most important consideration in judging someone. It's all about beauty. I want to say that maybe a lot of Instagram influencers are like that. No? What do you guys think? It's all about looking good now, right? It's all about that perfect photo. Um, do I look good? You know? That's what you just wrote on your notes. Yeah, Facetune and filters and just you know, it's sad. It's so sad. Filters are way out of hand. What's that? What is that called? Where what's that word? It's all over. where like their picture is like top notch and then they look completely different. Is it called phishing? Is it phishing? What's that word? How do I not catfishing? There we go. So out of the loop. Yeah, yeah, right. Interesting stuff we're going over today. That's for sure. Who knew that a bunch of people just have personality disorders? So when you care for this is cluster C that I'm going. No, this is cluster B. Okay, so when you're going over cluster B, when you're caring for them, you're setting safety measures, right? Specifically for borderline because they want to what? Harm themselves. They'll be so dramatic that they're you can't leave me. So they're gonna cut themselves. So safety measures, okay? And they'll manipulate you with histrionic. They will use your seductiveness to guilt trip you and get what they want. They'll become very verbal. So be alert to that and set your limits. Hey, it's not okay. You can't say that. That's not allowed. So if you're setting your limit, make sure everyone on the unit is abiding by those same limits too. Okay? So and don't seek their approval. Like no, they're not supposed to approve of you. You're the nurse. Okay? Don't argue, don't rationalize, and don't bargain. Your no is a no and your yes is a yes. Okay? Confront all their behaviors with cluster B. Okay? There's a consequence to your freaking behavior. Confront them for it. And they will know that they're wrong. Okay? Makes sense, right? And you're using a calm tone of voice. Avoid rejecting or rescuing. So, what this means when histrionic people or borderline or any of the B's, okay, if they think, oh, I don't fit in, oh, if they're dramatic, if they're good or bad, don't go to their rescue. Let them talk it out. If they start to gaslight you, let them do their own thing. Don't avoid the rescuing. Don't help them out. Okay? Your no is a no, your yes is a yes. Even if they don't like it and they get dramatic, no intervention necessary. Okay? Be positive, be friendly, but show your limits. If your patient's talking about themselves, like their thoughts about themselves, their relationships, the view of their environment, even if they're saying, "Oh my gosh, this sucks. Oh my gosh, this is horrible," listen to them. It's part of the disorder. You're probably gonna have to repeat yourself constantly and follow through with everything that you've promised. Okay, make sense, guys? Now, personality C. This one, I can kind of relate to this one. We all have specific points of these disorders in ourselves, or maybe I should just speak for myself. We'll see. Okay, so cluster C, it's anxious and fearful. Those who are insecure, maybe a little bit shy. I can sometimes relate, or I used to relate more to it than now. Okay, so these guys are avoidant, dependent, and obsessive compulsive. Okay, avoidant. These guys have low self-esteem. Okay, a pervasive pattern of social inhibition, feeling inadequate, hypersensitive to negative evaluation. They hate being criticized. They'll take it personally. This begins early in your adulthood. Fear of being rejected, avoiding social relationships, and low self-esteem. So these are the guys. If there's a party at work, they're not going to go. They're afraid of being criticized. Okay? Um, they want to be in relationships, intimate relationships, but they're afraid of being criticized. And they're just afraid of being involved with people. So they avoid the relationship, although they desire them, right? Afraid of being criticized and rejected. Okay? They view themselves as inferior. Oh, I'm not perfect. I'm not pretty enough. I'm not good enough. I'm kind of boring. So although I want a relationship, I'm gonna avoid it because I don't want people criticizing me. And these are the guys who will not do anything new or take risks because abandonment is real for them. You know, they're avoidant. They avoid all of it. I have to be liked. I can't look like a fool. It's just such a tough and dangerous place. I'm not gonna interact because I don't want to be hurt. So rather be isolated instead of risking being criticized and then crying about it. Okay? I'm unlikable, I'm awkward. It's better not to do anything that than try something that I might fail at. If people notice me, they will criticize me or reject me. Okay? I think a certain level of this can be relatable to a lot of us, in my opinion. What do you guys think? Unless you guys are the toughest people on planet Earth. No? Right? Yeah, I think it's okay. I think it's okay. Some people have like the extreme of this, and sometimes we feel that way. It's totally fine. Yeah. I went over this, all right? Am I crazy? Yeah, I did. Dependent personality. These guys, these guys have to be in relationships, okay? Like, if they break up, the next day they're with someone else because they rely on these other people. They can't make their decisions. They need others to be responsible for them, okay? They will not disagree with others because um, they feel helpless when they're alone and uncomfortable. So they're going to agree and they're going to say yes so they can be with someone and to have, whether it's in a relationship, an intimate one, or a friend, friends, or any form, okay? They urgently seek another relationship as a source of care and support. They can't be left alone. They have to be with someone, okay? They can't initiate things. These guys generally aren't leaders. Um, they won't disagree with you ever, 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 because they need someone. They need someone to be there with them. They depend on someone. Literally, it is exactly what it sounds like. Okay. I can't function without the support of others. Okay, without the advice and reassurance, I can't exist. Constantly asking someone, I'm okay, right? I'm okay, right? I'll be fine, right? My boyfriend's not gonna dump me, right? I'll be fine. I'll pass, right? But constantly, constantly, I can do this, right? We can do it. In any situation, I am probably wrong. It's probably wrong. So I'm just gonna agree. Okay? People will abandon me if I show my expression, whether it's anger or, being upset. I must keep people near me so I won't be alone. If I'm alone, I may be hurt. Obsessive compulsive. So this is different from obsessive compulsive disorder. Obsessive compulsive personality disorder is different. Okay, I may have certain traits of this, I think. Um, a pervasive pattern of preoccupation with being a perfectionist, orderly, mental and interpersonal control, okay? Flexibility, openness, efficiency, beginning by early adulthood. Perfectionists, control freaks, and being rigid, okay? I'm not a control freak, to be honest. I'm not. I used to be. But I'm just very organized, right? These guys are lists, schedules, details, rules, okay? Sometimes, like the extreme measure of this, perfectionism interferes with task completion. They're so hyper focused on certain details, like minor details, that they can't really get the job done. These guys are often workaholics, and more than they're productive. It's all about productivity. You are, um, you know, you are who you are based off of your job and the kind of work you do, and if you're a workaholic, then perfect. Um, Inflexible, rigid, right? Reluctant to delegate tasks or work to others because my way is better than yours and I'm gonna get it done. These guys can't throw things away. I don't want to throw it away in case I'm gonna need it, and it makes them anxious. Should we throw it away? Should we not throw it away? Okay. Strict rules in life. Okay. By focusing on details of a situation, one will reduce the chance of making errors. Right? No room for errors. It's That's what they're all about. I can't make a mistake. It'll be the end of the world if I do, right? A person is defined by what they do. The better job you do, the better person you are. Rules must be adhered to. Okay, emotions must be controlled. Okay, I mean, maybe some of us are like that a little bit. No, I'm kind of like that sometimes. I mean, not extreme. Errors, we're all human, right? To err is human. Um, but I make lists. to remember to do things, right? I may be a bit of a workaholic. Um, I feel better if I get the job done. I don't know. Can you guys see the obsessiveness in me or no? Or is it just my brain playing tricks on me? No? No? I'm not obsessive? I guess not. I guess it's all in my head. If you are, I can't tell. Do you guys remember my bookshelf was white last week? Do you guys remember that or no? I was so annoyed that it didn't match anything in my room that I returned just to get this gray color. That's how obsessive I can be sometimes. Identify and help address current stressors with cluster C. Okay, there's always a stressor behind it. Okay, what's causing you to feel this way? Be aware that strong countertransference often develops in clinicians because of clients' excessive clinging. Be aware of that. Evaluate clients' ability to care for themselves, especially for avoidant and dependent personalities. Help client identify liabilities and assets. Emphasize strengths. If they think they're not good enough, emphasize their strength. Reframe their thoughts. Okay. Point out what the client when client negates own feelings and opinions. So with the dependent personality traits, if they say they're not good enough, okay, if they say that their opinion doesn't matter, tell them. Point it out that it does. Okay, tell them, hey, you just told me your opinion doesn't matter, right? But it does, you know? It's okay to reassure them. We technically don't go over nursing diagnosis, but I like them. I like Nanda. Okay? These are really good. Oftentimes, these guys are anxious, they can't cope. Violence, self directed violence, impaired social isolation, fear. Just go over them to know. Obviously, the goal that you want to meet. Aggression, self-control, impulse, self-control, social interaction, fear level, self-mutilation, and abusive behavior. So these are the goals you want to meet, right? Make sure you help them control their aggression, their impulses. Don't enable their isolation. Work on their fear. Okay, their abusive patterns. Work on it. So you don't really focus on this too much, but these are your outcomes, the goals you want to meet. Okay. Cognitive behavioral therapy. A fancy word for this is dialectical behavioral therapy. It's like same thing as cognitive behavioral therapy. This is where the therapist comes in. There is no FDA approved treatment for personality disorders. You just treat the behavior. If they're anxious, you give them a benzo. Okay. If they can't sleep, you give them Seroquel or Trazodone. Right. You treat the behavior. Okay. Milieu therapy, right? Utilizing everything in your environment to provide the best possible care to limit their, their feeling of being confined. This is what this is. Okay. Safety plan. There's always a safety plan. Monitor warning signs. With borderline personality disorder, remember they're at risk for suicide. Monitor that. Perhaps you can place them on a one-to-one, right? If they verbalize that they do have a plan, make the environment safe, coping strategies, social situations that can help distract. Always identify people who I can ask, who help them identify people who they can ask for help, professional, right? And then refer them. When you discharge them, refer them to therapists. Teach them what? Deep breathing. Teach them guided imagery. This is where cognitive behavioral therapy comes in, where you have to reframe how rigid and inflexible they are. Okay. So when you're studying for this chapter, you're going to start from where it says cluster A all the way to cluster C. That's the most important. Those are the most important slides. Okay. That's it. Makes sense, right? It's a cool chapter. I like it. Okay, we're good on time.